All right, you guys, welcome to Wellness Wednesday. Look, today is all about knowing your risk for heart disease. There's a way to calculate it, okay? So we are using a risk estimator from the American College of Cardiology. I just Googled this. I've also tweeted this link for you and put it on my Facebook page. So this is specific to people ages 40 to 75. Now, Mark is going to answer these questions for himself, and we're going to kind of follow through. In the meantime, I've brought in Baylor cardiologist Dr. David Loftus with Baylor Scott and White Heart and Vascular Hospital to help us through this. Thanks so much for coming in early.
Absolutely. Thanks for having us.
So ideally, ages 40 to 75, why do we target that age range?
Well, that was the calculator was based on studies that included patients in that age range. That's where the data came from.
Okay.
So that's where the strongest advice comes from.
Okay, and so, you know, stuff that Mark is putting in includes his race, his age, whether he's got a family history of diabetes, and then also stuff like your LDL cholesterol, total cholesterol, blood pressure. So you get all of this information, you input it, and then what do you do with the information? Right,
so as we'll see as he goes through this, it's going to spit out an estimated risk for over the next 10 years of him having a heart attack, stroke, or a cardiac related death. So we call that your 10-year risk estimate. And that helps you start a conversation with your doctor or healthcare provider about ways to modify your risk if you're at high risk, or other ways to make yourself more healthy.
Okay, and what if you don't know some of these numbers? I know some people go, oh, can I guess my blood pressure?
Well, we always say know your numbers, and these are some of the important numbers to know. So if you don't know your numbers, then seeing your healthcare provider to find them out is a good start.
Yeah, good start. And then Mark, you are super low risk.
Well, let's hope I can maintain that then. So what numbers am I looking at most here?
So you're looking, so this is your 10-year risk up here, the 0.9%, which, not surprising, is very low.
Okay.
And then you'll notice as well, it gives you a lifetime risk. So you're relatively young for our patients, but over our lifetime, we have risk that builds up eventually as well.
How accurate is this?
So they have refined this over the years. When it first came out several years ago, they actually found that it is possibly overestimating the risk a little bit.
Okay.
So they have refined it, and we sometimes use other tools such as calcium scores to help refine the risk further if we need to.
I'm hoping we can do something with that next week. Thank you so much, Dr.
Absolutely.
Loftus. Appreciate that. And you know what? I sent this over to Greg. I sent it over to Melissa and to Larry. I see their phones out. Did you guys get a score?
I did.
You did?
Low, but I think I lied.
Okay. All right. We're going to check in. Greg, have you done it yet? Not yet. You're going to.
No, I have.
As soon as he gets to the gym.
Yeah, exactly.
I will get to it.